When you are trying to answer surgical question in the NCLEX exam, the first thing you want to do is to identify that this is a surgical question. How do you identify a surgical question? You are going to see the name of the surgery. Now, if you look at this particular question, you can see right here the name of the surgery. Most especially when NCLEX is testing you on any surgery, right? They commonly test you on pre-op care, post-op care, and then complication. Now, when the NCLEX is testing you on pre-op, post-op, they are going to use, when the NCLEX is testing you on pre-op, they are going to use this keyword, schedule. Right. So you can easily know that there's something going on. Amount maybe you add. Maybe you add. Now, in order to answer surgical question on the NCLEX exam, the first thing is to identify that the question you are answering is a surgical question. So how do you identify? By the name of the surgery. You just want to see the name of the surgery. Now, if you look at this particular question, you can see right here, this is a surgical procedure. It's not within your scope of practice. So it makes no sense to start thinking about it. All you should be thinking about is pre-op care, post-op care, and what? Complication. Right. Because anytime the NCLEX is testing you about surgery, is it that the NCLEX is testing you about pre-op care, post-op care, complication? Right. Nothing more. This is what you should be thinking. Immediately you can spot a surgical name on a certain question from the body of the question. You know, I always do say it. This is the body of your question. This is the stem of your question. And what? This is the what? Answer keys. Immediately you can spot the body, the stem, the answer key. Just from the body of the question, the NCLEX is going to give you the name of the surgery. Then immediately start thinking about what? Pre-op care, post-op care, and what? Complication. Please always think about these three things. You will never go wrong. Now, that is the first step. We are talking about identifying. That's what we are talking about now in this video. Identification of a surgical question. You identify by the name. Now, let me show you another example. Right here is another example of a surgical question. You can see right here, cardiac catheterization. This is a surgical question. The question will either be about pre-op care, post-op care, or what? Complication. Right. You can never go wrong. Now, let me show you the last example right here from the NCLEX PN exam. Right. You can see from the NCLEX PN exam, colon recession. So the same thing as well, to immediately start thinking about pre-op care, post-op care, lastly, complication. Now, the way the NCLEX is going to write your question on pre-op care and post-op care will be different from the way the NCLEX is going to write the question for complication. Right. The way the NCLEX is going to write the question for pre-op and post-op will be different from the way the NCLEX is going to write for complication. Now, for pre-op, NCLEX most likely we write it like this. A patient is scheduled for colon recession. Right. Let us see another example. Look at right here. A client who is scheduled for what? Endoscopy. Right. You can easily tell that the patient has not yet performed this surgery. So what you'll be doing at that moment is pre-op care. Right. Pre-op care. So pre-op care also talk about mixture of things that are also part of post-op care as well too. Right. But if the NCLEX is testing you on select or apply. Like it's a select or apply question. The NCLEX can possibly test you on both pre-op and post-op care. Like now, look at this question. It said the patient is scheduled for the surgery in 2 hours in the outpatient department. Now, what this question is trying to say is that this patient is scheduled for the surgery, and immediately they are done with the surgery, they can leave. That's what the question is trying to say. They don't need to stay in the unit. They can leave. So NCLEX is trying to test you on pre-op because right now they are just scheduled, and when they are leaving post-op, and most likely they do this in a select or apply question. Now, let me show you how the NCLEX will test you. Okay, let me just give you one example for pre-op. You can see right here, back to this particular question, you can see, right, scheduled for surgery, right? So, pre-op. The time NCLEX might mix it up with post-op, right, will be a select or apply question, right? Also, you can also pay attention. Maybe the NCLEX can either say, okay, the surgery has already been done. What would the nurse do after the surgery? You can also pay attention because the NCLEX can also test post-op as well too in a standalone question. Right? Don't get me wrong. The NCLEX can test post-op care in a standalone question, but the NCLEX, I'm trying to tell you what show up on the NCLEX the most. What show up on the NCLEX the most is pre-op in a standalone question and monitoring for complication, right, in a standalone question. That's what I'm trying to say, because obviously it makes sense, because pre-op, if everything is not done right, surgery can go bad. If you don't monitor your patients after surgery, it's a problem as well too. Right. So now, look at how the NCLEX can test complication. You can see right here, it's different because right now, this is a surgical procedure, but look at what the NCLEX is saying. The nurse is assessing a client who had what? Cardiac catheterization. That's a surgical procedure. But look at what the NCLEX is saying now in this term. Which of the following finding would require immediate follow-up? Now, immediate follow-up means that after the surgery, there's a problem, right? There's a complication, and we are trying to report that to the doctor or follow up on that. Right. So all you just need to look for is check your answer keys and then find out which of the following uh findings right here is a problem or a sign of what? Complication to that particular surgery. Now, next video we will start talking about pre-op care, right? Pre-op care. Then another video I'm going to talk about post-op care. Then the last video I'm going to talk about complication. Now, when I talk about pre-op care, second video, third video, post-op care, and last video complication, then the fourth video, we are going to start answering question. Right now, don't be bothered about answering the question. I'm going to show you how to utilize the information to answer pre-op care type question, post-op care type question, and complication type question. So I will see you in my next video.